In this case study of a radiocephalic arterial venous fistula, we are hoping the exam gives us insight into whether or not the access is working, or if there are any reasons it might not be functioning properly. We are looking for any areas of flow-limiting stenoses, patent side branches, or evidence of inflow or outflow disease. In the first couple of images, you can see the sonographer starts with the radial artery in flow. This is a perfectly normal waveform, low resistant, even monophasic. This is perfectly normal for a pre-anastomotic artery waveform. Moving through the anastomosis. And here at mid-forearm, you can see that the diameter has changed. It's increased. So we continue on. Sonographer takes measurements with corresponding waveforms. And if you notice here, there are 3 measurements. This is likely pre at the max site of diameter reduction and post diameter reduction. So, and looking in these measurements, we can tell that the diameter decreases to less than half of its previous measurement. So we can expect to see some increased velocities here, disturbed flow. Just continuing on with measurements showing the decrease in diameter and distal to that segment. And there's the velocity increase. And this is likely right at the area of the decrease in diameter. Now the sonographer has moved distal to that decrease and velocity increase, and we get a significant decrease in velocity. So this gives you all the information you really should need to make a proper diagnosis. Just showing how the flow continues on up the arm. And this is at the ACF. So what can we conclude from this study? Well, first, the fistula is patent. Second, 4 centimeters central to the anastomosis, a focal site is present where the diameter decreases from 1.43 centimeters to a half a centimeter. And then beyond that focal site, there is a deterioration of the waveform, suggesting that the focal stenosis is flow limiting for this fistula. So that would be your final impression.